Hey, good morning.
Good morning.
Dr. A, how you doing?
I'm good. How are you, sir?
Hector?
Good morning.
Good morning. So, back in this room again. I think last time it was our first time in this room, and I think the lighting and everything is better than the other room. And we are going to talk about a very important topic today. The topic is really kind of what we specialize in. So, when somebody asks what we specialize in, what do you tell them?
We specialize in adults with significant dental needs that need help now.
Very simple and to the point, right? That's what we specialize in.
Right.
It doesn't mean that we don't do normal everyday dentistry, because that's what we do every day. But what we're really built for is somebody who is exactly what you said. I mean, an adult that has found themselves in a situation where all of a sudden they're told, you need a lot of work done. And how does that happen? We always say, dentistry is cumulative. And so you can go through life, let's just say you're in college, you have a little issue, don't really have the funds to, or the time to take care of that.
Yeah.
You have some kids, you have some more issues, and not making it to the dentist on a regular basis, and these issues build up.
Yeah.
They're cumulative. It's like I say, it's about entropy, and things tend to head towards a random disorder, especially if you have, let's just say, a perfect storm. You have risk in all three areas. You have perio risk, you have functional risk, tend to grind your teeth, a little more stressed, and you have aesthetic risks and bio risk with tend to get some decay. Maybe when you're younger, drinking energy drinks to stay up at night and not brushing your teeth before you go to bed, all these things, not flossing on a regular basis. And now you've accumulated a laundry list of problems, and you've tried to go about it and keep up with it through traditional dentistry, what I call insurance dentistry, where it's $1,500 a year and you plug away at it, but you find yourself behind the 8 ball, and now this list is all of a sudden accumulated, as things do, into not twice as much, but 3 times or 4 times as much. And you're like, what in the world am I going to do? And then in that situation, it can get to, how much can it get to?
25, 30, 40, it can get.
It can be
high up
scary. And what happens, the more complex it gets, and involves more team members. So when I say that, I mean it can be teamwork dentistry. It can get to one level and we can handle it all by just rebuilding the teeth. Or the next level would be you have to rebuild the teeth and restore the gums and the bone.
Right.
And the next level is you have to see the periodontist and the general dentist, and you have to also see an orthodontist to put the teeth back into some order. And sometimes it involves the endodontist as well with some root canals. Okay, that's what we're talking about. If you're going to do that, yes, it can certainly add up to a considerable amount of money. So our point is, if it's going to add up to well over $10,000, how much does insurance matter?
Insurance after reaching up to 10,000 doesn't help as much as
It is
it's more of a coupon.
It's a coupon, right? And so because you have an insurance maximum, so many times if we'll tell the patient this is going to be about $25,000, they say, how much does my insurance cover? My insurance covers like 80%, right? Like up to a limit of $1,500, or sometimes $2,000 would be very good for an insurance company. And the patient's like, so it really doesn't matter. I'm like, wow, it's $1,500 per year. And most of the time in these situations, they don't have the luxury of doing it over 3 or 4 years, because why?
If you do it over too long of a span, things kind of don't match up. Maybe the aesthetics won't be as good. There's some different reasons.
Yeah, and does it get worse in the meantime?
Yeah.
Right, so over time, in the first year, you may have $25,000. In the second year of having to wait until you can get it done, it jumps up considerably, exponentially. So that is the issue, and that is where you have to put a plan together and make the investment. And the sooner you do it, the more conservative, the more predictable, and the less costly. So that's the scenario that we're talking about. We'll try to provide some examples of what these cases look like. Worn dentition, somebody who's really ground their teeth down from malocclusion or stress or TMJ issues. Somebody who's been involved in a traumatic accident and has broken many teeth and has gone with a large bridge that is now failing. Now they need considerable amount of dental work done in the form of implants and prosthetic dentistry to fix it. Somebody whose smile has really gotten out of hand and no longer resembles something where they're confident smiling, and it's something they've been wanting to always get to. Now they have the time and money to do it, and they want to do it the right way, where it's not just a smile enhancement, but maybe a smile makeover. So those are some examples of what we're talking about. So the point is, in these scenarios, what would be important for somebody to consider?
Yeah, some questions that if you're going to go into something like this, that you should ask.
Yeah, you should ponder some important questions, because now you're making a choice on your dentist not based on who's on your insurance list. You're making it on who you feel you want to get married to.
Yeah, I agree.
Yeah.
So one of the first questions, especially for those patients who research and kind of get to understand what they're getting into, is the treatment options. So that's a conversation between you and the dentist of what's the ideal treatment option for me.
Yeah, you want to start with what would be the best. And I always like to say, I'm not diagnosing somebody's pocketbook. I'm diagnosing the problem. And you want a chance to have our best. Because the best, the perfect scenario, it's going to look the best, it's going to feel the best, it's going to last the longest. And hopefully leave the most amount of tooth structure. So an example of that would be, yes, Dr. A, if you were the patient. One option is you do it like this, but it's going to involve a periodontist to level the gums, to build the bone back, to put some implants, and it's going to involve an orthodontist first to move the teeth in the right position. You're not going to like that answer because it takes more time and money. And what you're going to need to know is, what type of options do I have? What would happen if I forewent the orthodontics, or if I skipped the periodontist? It sounds like, yeah, why not skip them? Well, because there's a cost to doing that. What would be the compromise? What would be the result of me doing that? And you really want to talk to your dentist about that at length and have a discussion and have them put you in a scenario of what would be the consequence of trying to take a shortcut. Or another scenario would be, Dr. A, this is going to, be this much money, and it's going to take about a year to complete it. Your question may be, well, could I
take longer?
Could I phase it?
Yeah.
Could you phase it? And sometimes we have to be creative in how we could phase it. So it's like, that's a good point. I mean, if you're taking a $35,000 project and you're going to phase it, I may ask, what chunk do you want to bite off right now? $10,000. What could we do for $10,000? That would arrest the problems and put you in a holding position to where it's not going to cost you too much on the flip side of that, right? So those are good questions. Can you phase it? And if you do phase it, what would be the end compromise in this situation? So that's an example of asking, what are my treatment options, and what would be the consequence of having to go around the ideal treatment?
Right.
That was a good one. What's another one?
Another one, once you've already discussed the treatment options, is, okay, what's going to be the material that these restorations are made of?
Yeah, right, because you should be a part of that. When we're rebuilding somebody's mouth, like what we'd like to say a full mouth rehabilitation or reconstruction, there are considerable materials that you can use, which is great. I mean, as dentistry has evolved, you have gone from 1 to 2 materials to now, I don't know, really viable choices, maybe 10 different types of materials. Should you be part of that?
Oh yeah, absolutely.
Yeah. It's like if you're building a home, What type of windows do you want? What type of flooring do you want, right?
Yes, exactly.
Do you want tile? Do you want wood? Do you want limestone? Do you want granite? Or do you have to go with vinyl?
And understanding what it means to have each material.
Yeah, right. What that's going to feel like, what that's going to look like, what are the advantages or disadvantages. So with dentistry, you have Emax, you have porcelain fused in metal, you have zirconia, you have feldspathic, you have a lot of choices. And what's the difference between them?
It can be the difference of aesthetics, it could be strength, and we like to think of it in terms of a beauty to function type of ratio.
Exactly. It's what it, when we think of it, you have beauty over here and you have strength over here. That's a spectrum.
Yeah.
So as a layperson, you would think, I want the prettiest. But do you really? Do you need the prettiest in the back of the mouth of teeth that you destroyed because of wear and tear and chewing ice? Why not?
You need strength on those back teeth.
You need strength, yeah. And some people need strength in the front too.
Right.
Because, the back teeth take a lot more stress and force than the front. So no doubt about it, the front, you could stand to use a less strong material or a weaker material. But not always. Some people need strength everywhere. Doesn't mean we have to give you gold teeth everywhere because gold is the strongest.
Yeah.
You may use that on the very back where it
Right.
doesn't show. And PFMs in the other teeth that kind of show but not really show. And Emax in the front, what we joke around, party in the front, business in the back,
like a mullet. Yes.
Because it may be in your best interest to make those decisions to where you're going to forego just a little bit of beauty, but in the end, does it really matter? Or if you chose beauty, how long is that going to last? What is the maintenance going to be on choosing beauty? It's going to be more than if you choose strength. But if you're going to smile every day and want the prettiest smile you can get, it may be worth it to you. But you have to have those discussions. Like, Doc, if I went with all Emax, realistically, how long can I expect it to last? Because anything you do is going to require maintenance. And that's a big take home. You're not going to get something done and say, okay, fixed it, forget about it, and not see your dentist anymore or not take it in for maintenance, right?
Exactly, yeah. Another good question you've touched on already is who's a part of this team, and the lab is a huge component of this team.
Yeah, they're the unsung hero a lot of time, and you have the dentist team, the specialist that may be helping with root canals or orthodontics or implants, the periodontist, and you have the dental technician. You don't meet them most of the time unless you have an in-house lab. Most of the time they're located wherever you find the best one, right? So in our case, we work with one in California. And you want to know, who is this person who's affecting my life and touching my restorations, making the restorations? So the dentist is in charge, kind of like the superintendent or the one coming up with the plan and supervising the whole thing and actually making the preparations. The dental laboratory is actually fabricating your Emax or PFM or feldspathic zirconia restorations. And what you would like is a dentist-lab relationship that has
stood the test of time.
Exactly. That has stood the test of time. So for instance, the lab that we work with, Frontier Dental Lab, we've worked with Frontier. Gee, Hector, how long has it been? I mean,
Over 20 years.
Over 20 years. It's closer to 30. And so there is some goodwill built up there. And there is some experience in our relationship that the patient benefits from drastically. Because I will tell you, knowing a lot of dentists and having a lot of dental discussions, you go out on the golf course when the dentist is like, yeah, I'm trying a new lab. Why are you trying a new lab? What happened? Well, the last case didn't work out well, and so I heard about another lab and trying them out. Well, you don't want to be the patient that the dentist is trying the lab out on. That is a big risk. If I had to switch to another lab and try somebody else out, it would be scary.
Yeah, there's an adjustment period to that.
Yeah. I mean, you can't do excellent work as a dentist and have the laboratory give you mediocre work, because in the end it's going to be not excellent.
And vice versa.
Vice versa, yeah.
As
You
a
can't
dentist.
do mediocre work and give it to the best lab and say, make this into excellent. You can't do it. It just doesn't work. Patients have to understand that. You have to consider your lab and ask those questions about the lab. Are they accredited? Who's this lab? How long have you been working with the lab? Can I talk to the lab? Show me some of the lab's work.
Yeah.
So those are good, 3 good questions. Keep going.
So let's say we get this work done. What's the guarantee on the work?
Yeah.
That's a very important question.
Yeah, we actually don't get asked that a lot.
Right. And what happens is we have a system set up for if moments come up where, let's say, something chips, and again, maintenance is important. So you want to be seeing your dentist regularly to watch out for if anything's chipping, breaking, or needing maintenance.
Yeah.
But our system has been well in place and is very useful to handle these situations.
Yeah, we have a prorated system. So it's prorated over 5 years. So if something happens within the first 2 years, we're going to cover it. Something happens beyond that, it's going to be covered at a lesser rate up to 5 years. After 5 years, basically it's going to be full coverage on you. And we found that that's fair, and we found that luckily we're not having to do that often where we're having to completely replace something, because that wouldn't work for us. So we have to make sure that we're doing things with a good plan in the beginning, with the best materials we can, with good choices with the patient. So it is going to give a return on investment for that patient and not cause us issues where we're having to go back in and redo work, because that's never good. Now, we do it and we're happy to do it when we need to, and that happens. But it's in the best interest of both parties involved, the patient and the dentist, to do it right the first time and to make it last and to have the patient happy with that. Now, let's say, for instance, that you take a risk, want to save a little money, and you're going to go out of the country and get work done. How's that working out with service after the sale or adjustments afterwards or replacing something?
It doesn't work very well most of the time.
How could it? Yeah.
Yeah, if you have to fly out to see this dentist and you come back and home and now you have an issue, you're flying back out again.
Yeah. The dentist has thousands of miles between you and his work that is going to be a barrier to you going back to that person. And trust me, if you're going to get a considerable amount of dentistry done, it's going to require adjustments and fine-tuning and some tweaking. So that's a very important thing to consider. Have that relationship with your dentist. What happens if I do this, or if that happens, or I'm not happy with this? Have that discussion up front. All right, I think we have one more question.
Yeah, one of the, I think, biggest questions on a patient's mind that we always talk about, what is going to be the shade? What are these going to look like?
Oh, yeah. Yeah, so this brings us to a very important discussion on how do I know if I'm going to like it? And it is all about the prototypes or the trial smile. So I remember when I first started, I would make some temporaries and I'd say, don't worry, they're just temporary. When they come back from the lab, they're going to look so much better. Now that was always scary because I didn't know if they were going to look better. The lab was giving me something that all of a sudden I'd put in and I would expect magic to happen and that the patient, it would be perfect. That is no way to practice aesthetic dentistry or reconstructive dentistry. What you really want is to measure 3 times, cut once, as we say all the time, to where you're in a set of provisionals or you have your trial smile that you're wearing around for 3 weeks between the period of you getting your teeth prepped and putting the actual porcelain restorations in to where you can preview it. And so we get that patient back after a week, and we look at things after the dust settles with your face now not numb, and you feeling fresh, and you feeling like you have confidence in smiling with your new smile. And then we look and see how it fits in the face, what the color looks like with your particular complexion and your expectations. And we see how it works, and we also see how it worked with people that know you really well. What did people say? And what do we tell them?
Did anybody say anything about your new smile? Did anybody notice?
Yeah. And the type of notice that we would want is, wow, what did you do? You look good. Did you whiten your teeth? Did you do your eyes? Did you just get a facial? It's not like we want them to say, oh, you got your teeth done.
Yeah.
And oftentimes they do not say that because it's so integrated, it's so harmonized with the face that it just looks good and natural. And I think patients worry about that sometimes. It's like, gee, what people are going to know I got my teeth done? It's like, they don't. What they know is that you're looking your best. And that they know something was done, but they can't quite put their finger on it. And that is what we're going for, right? And how's that feel in your face? How does it work with your phonetics?
Your bite.
Your bite. How does the bite feel? All those things are really important to try out in your provisionals. And then for the dentist to be in charge of making those tweaks to the provisionals and then transferring that to the lab, and then the lab to give you back what you have in the provisionals. I have seen a lot of patients that have said, I loved my temporaries, but I did not like the final restorations. And that is typically because there wasn't integration between that communication between the lab and the dentist, between the temporaries and the final porcelain restoration. So I think, more back to color, it is a big concern for the patient on what the color is going to be like. Now, I can tell you from experience, when we look at the 16 different shades of white, and the patients are trying to make these minute changes, and I've got them up towards the top end of the spectrum of white, they look at it and they're like, they can't really see they can't split hairs on, an OM1 and a 0.5 M1 and a 1 M1. They don't really see that, and I can understand that. I mean, it's like when you're showing a patient an x-ray and you're trying to show them this, and they're like, yeah, I think I see it. I mean, our eyes are trained on that. So what you have to be able to do is feel that with the patient from the beginning. What are you wanting? Are you wanting natural white? Are you wanting something to harmonize with the rest of your teeth? If you're not getting a bunch of teeth done, let's say you're doing 4 teeth and you're wanting it to integrate with the teeth that aren't being done, you have to really think about and help guide the patient on how that's not going to look funny, right? Or if you are doing a bunch of teeth and it's carte blanche, what type of an effect are you wanting to make? Are you wanting to make an effect where you walk in a room and everybody's going to notice because they're that white? And some people can carry that off. Some people love that. It depends on your personality, and that personality has to be a match with the shade that you choose for the dentist. And again, when we choose the provisional shade, we don't have as many options for the provisionals, but we can be in the right zip code. And I have had it both ways, where you put the patient in provisional, every now and then they'll come back and they go, I want my teeth to be a little bit more subtle. You dial it down a notch. Or, I need a little more pop. You pop it up 2 notches. And so you can dial that shade in with the right opacity, translucency, texture, and value. And that's what we consider the degree of whiteness, so that you can be sure that what you're paying for is going to be the effect that you were thinking in your mind. And that shade discussion is an important one to have with your dentist.
Exactly.
Very well done. Thank you.
Thank you, sir.